you've got an ECG, which is the snapshot.
Yeah.
Then we've got that 24-hour monitor, which is so people who've got palpitation maybe once or twice a day.
Yeah.
That's more likely to pick it up. And then you have the longer form tests like the Holter monitors, which are either 7 days or 2 weeks, aren't they?
You can have them for up to 2 weeks now, and they become really intrusive. So I think the very old style Holter monitors, you'd have 3 wires, one attached to sort of different parts of your chest, and you'd carry a little battery around in your pocket. But that's very good for short periods, so 24 hours up to 72 hours. The key thing there is you want it on when you're getting the symptoms. So if somebody only gets their symptoms once every 2 weeks, once a month, then tends not to be very useful. But obviously, if you're getting symptoms every day, that's great. The longer ones are a bit better. You can now get a little patch which you just stick on your chest, and you can post it back off to the hospital or wherever it's being analysed, and that can stay on for much longer, and that's slightly better for people who have intermittent symptoms. And I'm using them more and more, actually, to be honest. I find the more information you have, the easier it is to get to a diagnosis.
And the patients, they have to make a note of when they've got the symptoms, don't they? Then you can look back and see what the rhythm is at the exact time.
Absolutely. And some of the devices even have an activator, so you can press a button when you get the symptoms, and then you can track back and see what happened in the previous sort of 30 seconds. And that's really great, because especially I've had lots of people with palpitations where literally you can see the ectopic beat, the extra heartbeat, which we'll go into later, and then you can kind of see it a few seconds later, a little red marker where they've pressed the button. So you can confidently go to a person and say, look, this is what the cause of your skipped beat is, and it's something very benign, and it's very reassuring.
Yeah,
and it's a nice visual as well for someone who's had it.
And that's what you're hoping to reassure the patients that need reassurance. And for those where it is something worry, then you go
found
from
it
then on.
Yeah, exactly.
And I guess then we get into the implantable devices for really long periods of time?
Exactly. So in the Holter monitor, the ECG patches are probably the most common ones we use, but for smaller groups of patients, particularly for if we're worried about some of the heart rhythm problems which are slightly more worrying, you can implant a device which can sit under the skin, probably size of a pen lid, and it can stay there for up to 3 years, and it monitors your rhythm 24 hours a day. It will alert the hospital if your heart goes above a certain level or below a certain level in terms of the heart rate. But similarly, it comes with an activator or an app where you can indicate when you've had symptoms, and you can look and it'll tell you what your heart rhythm was doing at around the time you activated the device as well.